Chiropractor Scott here from East Coast Chiropractic, and we wanted to switch things up today and do a video for you on the most common problem that we see in women postpartum, and that can be in the early stages, but in some cases that can be several years after as well. So we've got Dr. Scott, we've got a model spine, we're also going to look at an x-ray today to help illustrate this as much as we can. And the problem is really broken down into two pieces. So you obviously know that, as you're going through pregnancy, the birth process, there's lots of relaxin, and a common finding is that the pelvis and the lumbar spine goes to a degree of what we call relative instability, meaning to create lots of motion through that pelvis so you can pass baby smoothly, things get lax and they have a lot of ability to move. And depending on what type of birth process you had, you may have had some doming and some diastasis recti, or perhaps your core was never properly rehabilitated after, which is extremely common, unfortunately, or maybe even the pelvic floor was not addressed appropriately. The long and short of it is, if this low back and this pelvis doesn't learn to be strong again, there's a strong chance that it's not going to perform well. It could be painful and you could wind up with some new problems. So the other issue we see when we're breaking down this problem is that the mid-back becomes hyperkyphotic, which means that it's too rounded and frankly becomes quite rigid. So you should have a normal curvature in the thoracic spine. It's roughly about 37 degrees. But through breastfeeding or bottle feeding and just carrying baby in car seats, the tendency is to go into this flexion dominant position, and it's extremely difficult on the spine. Night feeding is probably the worst possible posture ever because you're half asleep and you're literally just flopped over like this. Very hard on the body. So the combination pattern that we see is this hyperkyphosis, or too much rounding in the mid-back here, as well as relatively unstable low back. And if we actually look at the spine, we should have a very stiff, nice and strong low back, and we should actually have lots of quality motion through the mid-back. But typically what will happen is postpartum is that pattern actually reverses. So we're going to take a quick little transition and look at an x-ray so you can see what we're talking about in real time. So what we're looking at here is the thoracic spine, or the mid-back from the side. And what we're able to calculate by looking at the vertebrae and counting them and figure out where things are is the global angle, it's called an absolute rotation angle, of that thoracic spine. So we should have about 37 degrees in that thoracic spine. In this case, we're looking at about 47. So what will happen is, as that rounds and the rounding becomes more significant, there is significantly more postural strain. And a common finding too that we maybe didn't mention as much is the head will often shoot forward. So you may have seen that postural pattern before where the head trickles forward relative to the thoracic spine. And that's very common when it couples with this extra rounding. So these little boxes, or these blocks, are actually the vertebrae in the thoracic spine, so those main bones, and the little gaps in between, those are what we would consider the disc spaces. So we're always looking to make sure that the disc spaces look healthy and that the end plates or the ends of those bones look healthy as well. And of course, we're measuring that global angle. So to change this, there is a heck of a lot that has to go into it. It's not as simple as just doing exercises, but I did want to give you a snapshot so you can see what this looks like in real time, essentially beneath the surface, so you know what we're talking about beyond just looking at the spinal model. Okay, so we've briefly chatted about the relatively unstable low back that's not stiff and strong enough, coupled with that really rigid rounded mid-back. So to correct that pattern, there is a lot that goes into it, and I don't want to give off the impression that it's as simple as just doing the routine that we're going to show you. Typically, we need to look at remodeling the spinal tissue, which is a big job, and of course, there needs to be a very, very in-depth, proper assessment to know what we can and what we can't do. There are many things that are not indicated for some people that are for others, dependent on their examination, so please take that into account. So if you do this and you're noticing any discomfort or things just don't feel right, please stop. This is not obviously, again, for everyone. However, it's a pretty safe, benign way to start if you're struggling with some postural strain and need to get that core reactivated. So Scott's going to be our demo here, and we're going to run through a little routine. This is something that you can do daily. So you would start by jumping down onto all fours. This is called a lumbar locked thoracic rotation. And this is designed to basically improve motion, extension and rotation in that mid-back. So when you're feeling that pressure and things are locked up and you're rounded, this is a great counter activity to deal with this. So Scott's going to go down into kind of a modified child's pose position here, sitting on the feet. and then what he's going to do is post on his elbow. So depending on your body, you might find you're more comfortable going knees out. The reason we want to be in this position because this is going to keep that low back locked so we're not getting motion there. We want to isolate the motion through that mid back as much as possible. So we've got the elbow almost beneath the chin here, and we're as flat and stable as possible here. Never actually do this in a rounded position. We're trying to work against that hyperkyphosis, so we really want to try to get as straight and level as we can here. So what Scott's going to do now is take his hand and place it behind his head. So a couple of things simultaneously here. Scott's going to turn his head and rotate this mid-back up and look to the sky as high as he can, and he's going to breathe out while he does it. Hold it for 3 seconds at the top, so not only we're getting a stretch, but we're also activating some of those muscles, and then gently controlling it down. Common fault that we'll see with this, if you think about this being a tunnel, meaning this hand and this hand, we don't want to see that as the hand rotates, Scott drifts into my hand. Because what's going to happen is we're going to get too much motion through that lumbar spine, and we're not isolating movement through that mid-back like we want to. So you can run through 10 repetitions per side, under control with that 3-second pause, both sides, no problem. So after you've done this and you begin to mobilize a little bit, then we're going to focus on stabilizing. So the bird dog is typically a good entry level core exercise depending on your birth process and where you're at. But we're in a tabletop position here, so wrists beneath the shoulder and the knees beneath the hips. Posture is nice and neutral. Again, we're trying to avoid the rounding and we're trying to avoid the head trickling down. So a nice way to think of it is shoulders are ear poison. We're trying to keep them back and engaged, everything's solid. So what Scott's going to do from this position is extend one leg and flex one arm at the same time. And if you notice here, things are staying nice and level. He's going to hold that for a couple seconds and then gently control it back in. What we don't want to see here is that the pelvis is rocking and rotating as he does this movement. This is not a safe position. So think about having a cup of water on the low back. So as he's doing this movement pattern, we want to make sure we're not spilling the water. Going through this repetition-wise, 2 sets of 8 to 10 reps is typically plenty. If this is too difficult and you don't feel safe and stable, a modification would be simply to start with the arm. Focus on keeping everything nice and braced, but flexing that shoulder, bringing it forward, holding it, and bringing it back. If that's a little too easy, you can simply go with one leg. So Scott would extend one leg out, and then gently bring it back in. Of course, doing the arm and the leg simultaneously is the hardest one, so please be advised of that. So this would be an easy routine to just start mobilizing the thoracic spine and stabilizing that lumbar spine, activating the glutes, as well as some of these postural muscles all at the same time. If you have any questions or you need any guidance, be sure to ask us. We're always here to help, and we'll do whatever we can to answer those questions. In the meantime, hope this is super helpful for you, and have an awesome day.